All right, good morning, everyone, and welcome. My name is John Donadio. I'm the Executive Director of the New Jersey Association of Counties, and I again want to welcome you to this virtual workshop where we're going to cover a county overview on SNAP and Medicaid. We've got an outstanding panel for you today that's going to provide an overview of the hard work that our Board of Social Services and county welfare agencies do throughout the state of New Jersey. They're going to talk about how New Jersey is one of only 10 states in the entire country where SNAP and Medicaid are administered at the county level, and also touch upon some of the changes that are coming out of Washington that are going to be here before you know it. Of course, we're talking about, the administrative switch from a 50-50 match to a 75-25% match, which is going to have a significant impact on, again, county governments throughout the state. But before we get into some housekeeping and I introduce our speakers, I see that our president from Somerset County, the good Chanel Robinson, has joined us. Madam President, if you'd like to say a few words, the floor is yours.
Good morning, everyone, and thanks for joining. And John and your staff, thanks for putting this together. We're at a pivotal point that we all are looking at our next when it comes to social services or services that we're providing to our residents and or constituents. So again, thank you for joining, and I hope that you get everything out of it that you need as we continue to service those who need our help.
Great. Thank you, Madam President. Appreciate it. A couple of housekeeping things. If you have a question throughout the course of the presentation, please use the Q&A, not the chat, use the Q&A, and we will do our best to answer that question as we're working our way through the presentation. If we don't get to it, a question, you can email me it afterwards, and I will make sure to reach out to somebody who knows what they're talking about to get you an answer. I want to thank Angela Wolf and her. She has someone who's training with her today, Natalia, for doing a terrific job with all of our virtual workshops. So thank you. You do an awesome job. We appreciate it. And without any further delay, I want to introduce really an outstanding panel of individuals who I respect and admire and have gotten to know a great deal over the past couple of years, as they're always supportive of the NJAC conference, always supportive of this association. And I just appreciate it a great deal. The first of which is Lauren Bird. Lauren is a director at the Warren County Division of Temporary Assistance and Social Services. Thank you, Lauren. Next up is Cheryl Golden, who is the director of the Cumberland County Division of Social Services and a County Service Award winner, I think last year, right? Or 2 years ago it was. And then last but not least is Meredith Sheehan, who is the Director of Welfare for the Ocean County Board of Social Services and the current president of the County Welfare Director Association of New Jersey. So, ladies, thank you again for being here today and all the great work that you do. I appreciate it, and I'll turn it over to you.
Thank you, John and Chanel. Thanks for having us. Good morning, everyone. It's a pleasure having so many people join us for this presentation. As John said, I am the president of the County Welfare Directors Association. Our association meets monthly with really a purpose of advancing and improving public administration, public welfare, social services, and child support services within the state of New Jersey. This includes, but not limited to, the interchange of experiences and practices, organized study of social service, the public welfare issues, and really the delivery of efficient, effective, courteous, and professional levels of services for all of our clients. This morning, we are presenting an overview of the programs that we administer with a focus on SNAP and Medicaid and the reconciliation bill. But please keep in mind, the bill was only signed last week, so there is still much to review and really much to still become familiar with. As John said, we have Lauren Bird and Cheryl Golden with us. Cheryl is also the president of our executive committee of our association, and Lauren is the chair of our NJAC and public policy committee. We have a long history of a great working relationship with NJAC, and we really appreciate having the opportunity to be on today to discuss such an important topic. I'm now going to introduce to Cheryl, who will begin our presentation, and thank you.
Thanks, Meredith. Can we get the PowerPoint started? I can't see. Okay, great. All right, so good morning. So we're going to get right into the presentation, tell you how we're structured, give you a brief overview of the work that we do at the county welfare agencies. And we'll also talk about the two largest programs that we administer, Supplemental Nutrition Assistance Program, or SNAP, and Medicaid. So you've no doubt probably heard a lot of things lately about some of the upcoming changes to these programs as a result of HR 1, the recently signed budget reconciliation bill. So we'll go over some of that. But county welfare agencies exist in all 21 counties. They are boards of social services, divisions of social services, county social service agencies, Office of Temporary Assistance, etc. They may be named different things, but we serve the same purpose and we administer the same public assistance programs. I'm going to refer to them as county welfare agencies in this presentation. That name goes back decades. It's a historical name. So just for the purposes of this, that's the word I'll use. But just to know that that encompasses all of these different agencies. Can I have the second slide, please? So the CWAs administer specific federal and state public assistance programs for the residents of our counties. The programs are state supervised, but they're administered at our level. The federal programs include Temporary Assistance for Needy Families, or TANF, which is a cash assistance program for families with children. We have SNAP, which is food assistance for low-income individuals and families. Medicaid, which is healthcare coverage for low-income individuals and families, and Medicaid for aged, blind, and disabled populations. And then we also have child support services, which include parent locator services and support orders for recipients of public assistance. The state programs we administer include general assistance, which is a cash assistance program for single adults without dependents, and emergency assistance, which is temporary assistance with shelter and shelter-related expenses for TANF, general assistance, and SSI recipients. Next slide, please. So we're a county administered system, as you have learned. So here's your history lesson. The formation of the agencies go back to the 1930s and old age assistance programs. So the creation of county boards of social services to administer public assistance programs comes from New Jersey law, NJAC Title 44, or which was historically known as the Poor Laws. The statutes created that local service structure. So in New Jersey, like 9 other states, public assistance benefits are county administered. So we serve our residents, we employ our residents, and then the benefit dollars are infused into the local economy. The county pays a share of the total administrative CWA budget, which can be anywhere, depending on the county, between maybe 20 and 30% of our entire administrative budget. Our goal at CWAs is always to maximize those federal dollars that come in to pay for as much as possible, therefore minimizing the amounts that the county has to kick in. So as a result of all the programs that we administer, hundreds of millions of federal dollars come into every county, and they help to stimulate the local economy. I'll give you a quick example. In 2024, in Cumberland County, over $66 million in SNAP money went to Cumberland County SNAP recipients. So that $66 million is money that was spent in local grocery stores, helped employ people at that grocery stores, and helped businesses prosper. Last year, that same year, 2024, over $521 million in combined benefits were dispersed for Cumberland County recipients. So that money went to landlords, grocery stores, pharmacies, hospitals, healthcare systems, all of these places where these dollars are spent to help support these individuals. So the county's investment, again, is a piece of our administrative budget. So the county's piece of my administrative budget in 2024 was close to $5.5 million. So $5.5 million investment, 521 million federal dollars comes back into our economy. It's a 1% investment for all those dollars that then we turn around by the work that we do in our agencies. So, where does the state come in? So the Division of Family Development and the New Jersey Division of Medical Assistance and Health Services, under the umbrella of the New Jersey Department of Human Services, they are our supervising entities. They submit state plans to the federal government on how programs will be administered. They are responsible for all of the electronic systems that we use during our eligibility determination processes. They monitor our agencies, they conduct quality control reviews, and they approve our budgets. So that's basic history, the basic structure of our agencies. Now I'm going to turn it over to Lauren Bird from Warren County, and she's going to go over some specific details of SNAP and Medicaid and an overview of exactly what we do related to those programs.
Great, thank you so much, Cheryl. Next slide, please. Okay, so New Jersey Family Care is the state's health insurance umbrella that provides free or low-cost medical coverage. So this coverage includes families, disabled persons, elderly population, children, and low-income adults. Statewide, as you can see on the slide, the Medicaid program covers over 1.8 million recipients. Of that amount, 29.8% is the expansion population. So the expansion population refers to those that are low income who qualify under the Affordable Care Act Medicaid expansion. Okay, so family care and the program that we serve here in our CWAs is the largest that is administered in our programs. Next slide. So here you can see the thousands of people broken down by county that rely on Medicaid in New Jersey. It's important to note that thousands of these people rely on Medicaid to provide their full-scale healthcare related emergency and hospital coverage, inpatient services, routine checkups, dental and vision services, behavioral health, and prescriptions. Without this Medicaid coverage, recipients cannot afford and may not seek healthcare services that are crucial to their health and well-being. Go ahead, next slide. The next program I'm going to talk about is our New Jersey Supplemental Nutrition Assistance Program, referred to as SNAP. So SNAP provides monthly benefits on an EBT card to assist an individual with buying food at the grocery stores, farmers markets, and also participates with some online retailers. SNAP benefits cannot be used for alcohol, hot or prepared foods, or non-food items. Eligibility for SNAP is based on household size, income, expenses, and resources. So here you can see statewide in April of 2025, we had over 800,000 individuals participating in SNAP in New Jersey. Of this amount, as you can see with this breakdown, 42% are children, 30% are persons with a disability, and 22% are 60 of age or older. Go ahead, next slide. And again, here you can see the thousands of people that rely on SNAP broken down by county in New Jersey. And looking at these numbers, I just want to note that these are the recipients in a given month. It does not include the number of people that apply at our county welfare agencies that are determined ineligible or may report a change of income or circumstance that the county workers still have to work on the case to determine eligibility. In the next few slides, you'll learn some of the responsibilities and what that means at the county welfare agencies in determining eligibility for our SNAP program. Go ahead, next slide. So our New Jersey County welfare agencies are responsible to act on all applications filed in the county of residence, eligible or not. So that includes applications that may come in online or paper applications received in the mail, and those that actually come into our agencies to apply in person. So we're responsible to complete interviews for every single one of these cases, collect the applicant's documentation to analyze the application, verify the information provided by the applicants on applications, and compare it to the federal and state data systems. And this includes performing tests and calculations to determine eligibility. And I can tell you it's a lengthy and very cumbersome process for each case. Go ahead, next slide. So SNAP benefits, as well as Medicaid GA and TANF benefits that Cheryl mentioned earlier, are not permanent. So these cases are recertified every 6 to 12 months. And the redeterminations that we do in our agencies are very similar to the initial applications because documents are requested, they're collected, and they have to be verified, the whole process, by the CWA worker to determine if continued eligibility is warranted. Additionally, in between recert periods, those recertification periods every 6 to 12 months, the county welfare agencies receive match reports. They may receive information from a household indicating a change in address, a change in household composition, a change in income, and it requires the county welfare agency to determine eligibility again over and over to make an increase or decrease in those SNAP GA, Medicaid, or TANF cases. Part of the county welfare agency's responsibility is also to make referrals to our fraud unit. And in our fraud unit, we investigate the fraud and abuse of all of our programs. If the fraud has occurred, our agencies collect any overpaid benefits. Go ahead, next slide. So the responsibility, as you can see and hear, of administering these programs is an enormous amount of work, and it encompasses providing status updates. It's a large customer service based program, and resolutions for problems and issues with applications, denials, the issuance of benefits, etc. The call volume and request for information at the CWA level is a large bulk of the work. So for every application filed, the CWA is receiving, opening, organizing, scanning, uploading all of the data and information for all the documents that are mailed, dropped off, or sent electronically for the county residents that are applying or completing a redetermination, reporting a change, all the things that I mentioned earlier that may affect their benefits. Go ahead, next slide. Last, I have a slide here on managing our work requirements. So CWAs are also responsible for managing work requirements for all of our programs. So currently, work requirements are in place for those who receive TANF and GA. A CWA worker is responsible to complete work readiness, ability assessments to make sure that those that we serve are provided with the correct referrals to work activities. We also verify employment and earnings, verify participation in work activities. We provide financial work support such as transportation and childcare. And if clients are not compliant with the work activities, we sanction those cases for non-compliance. Once the recipient complies, then we lift the sanction for compliance. So you can see in all of the slides that I went over the responsibility of the CWAs that there's a lot of pieces to eligibility. It's not a permanent program. There's many changes that occur. There's many details that have to be put into a case to determine that we are correctly administering the benefit. Next slide. So now I'm going to pass it back to Cheryl to discuss some of the budget reconciliation.
All right, thanks, Lauren. All right, so we're going to go over some of the potential impacts, and we're going to use the language of potential changes because, nobody can say for certain what is going to happen. I can read the bill, I can read people's interpretations, and I can make an educated guess, but really we don't know the full impact of HR 1 at this time. So we'll start with SNAP, and what I believe is the easiest change to quantify, which is the change in the administrative cost share. So in our agencies, benefits, in our budgets, there are some categories or items that have mandatory percentages for cost sharing. SNAP is one of those programs. So currently, whatever amount in our budget is charged to SNAP administration, the mandatory cost share for the county is 50% of that total, and then the feds pay the other 50%. So the reconciliation bill changes that to a 25% federal share and a 75% state share. But because counties administer the programs, the cost is paid by the county for their staff and their operations. The state pays their share of their administrative costs to support their state agency activity, and the county pays the cost at the CWA level. Next slide. So here's just an example of the current cost share. So, we said County C, which, full disclosure, that is my county. So Cumberland County, this is our line item for our 2025 County Welfare Agency budget under, it says food stamp program because that's what the budget language still says, but it's the SNAP program. So this year, our budgeted amount for our administrative costs for SNAP is a little over $6.2 million. Federal and state share that is 50%, $3.1 million. County funds required, $3.1 million. Pretty simple. Can we go to the next slide? So under the reconciliation cost share, it takes that same exact number. Let's go back to 2025. Same year, $6.2 million. That's my total cost for administration under SNAP. Now the state and federal funds that we're going to get reimbursed for that activity is $1.5 million. And the county funds that are required to match that are $4.7 million. So the county goes from contributing about $3.1 million to $4.7 million of the CWA budget. Next slide, please. So in simple terms, there would be a $1.5 million increase in the county's share of the budget under the reconciliation bill. These changes for this provision are effective in federal fiscal year 2027, which begins October 1st, 2026, which is coming up. That's next year. So this is a change that we will have to implement in the last 3 months of our calendar year budget for 2026. As I said, these counties, these numbers are for my own county in Cumberland County. So we're considered a mid-sized county. So we have caseloads that are kind of in the middle or middle to high range as compared to, throughout the state. Obviously, smaller counties will have less of an increase in this line item, and the larger counties are going to have a lot more. But, $1.5 million is, I think, a lot of money for any county. Next slide, please. So this is the benefit cost share difference that's in the budget reconciliation bill. And here's where things, I think, get a little bit confusing and potentially very costly to the state of New Jersey. So right now, states don't contribute at all to that benefit amount, which is the actual dollar amount that are on those SNAP cards that are available to purchase food. It is 100% federally funded right now. HR 1 changes that. So in HR 1, they wanted state share for any states that have a payment error rate above 6%. That 6% is the allowable rate per the feds. So anyone that has a rate above that 6% will have to contribute toward the benefit amount. That contribution can be anywhere between 5% or 15% of the total benefit amount, depending on whatever the state's payment error rate is. Now, for federal fiscal year 2024, the state just received their numbers, their final numbers, and New Jersey's payment error rate was 14.33%, with the national average at 10.93%. So with that rate, New Jersey would have to pay 15% of the SNAP benefit amount, which could be upwards of $300 million. Now, that money's not coming out of the county budgets, but we're all New Jersey taxpayers, right? So we all are affected by this. But I just want to talk about a few things about that payment error rate, because it is confusing. We know that federal government doesn't make a lot of things easy, and they don't make understanding that these things very easy either. So a couple things I can tell you. First is that only 7 states are at or less than 6%. Over the last 20 years, the data for New Jersey's rate was in single digits, except until 2023. So there was a change in the way that these payment error rates were calculated and the way that they were reviewed. New Jersey has appealed a lot of their payment error rates, and they have won some of those battles. They're going to continue to challenge how the rates are determined and how those rates are calculated. But the most important takeaway on that payment error rate is that it's not related to ineligibility of benefits, right? So a 14% rate does not mean that 14% of the caseload is ineligible. Has nothing to do with eligibility for benefits. They are related to administrative errors, not eligibility. So that is an important thing for everybody to understand. Next slide. So that's some of the budget information. And now we look at some potential extra work now for the county welfare agencies because of the reconciliation bill. Lauren gave you a brief overview of all the day-to-day stuff that we do. So this is related to extra things now that we may have to do because of HR 1. So let's talk about SNAP and work activities. So right now, New Jersey is voluntary for work participation for SNAP recipients, meaning if you're on SNAP, you can go to the one stop if you want to, you can volunteer to maybe upgrade your skills, but it is not mandatory. It is, however, mandatory for able-bodied adults without children, which is the ABOD population. So they are mandatory to participate in an activity or, if they're not working full-time. So they've always been mandated to participate, but New Jersey has received waivers over the past several years that basically lift the enforcement of that participation. So we have not been engaging anybody in work activities unless they volunteer. The reconciliation bill no longer allows these waivers that New Jersey has been using. So with this population, we will have to start verifying their employment, the hours of their employment. We may have to engage them in work activities. We may have to impose adverse action if there's noncompliance. And this provision is effective immediately as of the passage of the bill. So we're going to have to make changes to the way that we are working with this population as soon as possible. So we're working with the state on those things right now. And not only our agencies, I believe this is also going to impact the workforce development system, which is the system in all of our counties that assist engaging people in work activities. They assist with finding full-time employment, possible training opportunities. So I think, that system is also going to need resources to make that happen. But this piece here will definitely impact the CWA's case management units. And it's going to require additional work. More work usually means more staff, which means higher administrative costs for these programs. Next slide, please. So some of the changes to Medicaid in this bill have to do with the redetermination for certain populations. So federal regulations require that a redetermination for Medicaid benefits must be conducted every 12 months by the eligibility determining agency, which is the CWA in New Jersey. HR 1 stipulates that this Medicaid expansion group, their redeterminations have to be processed every 6 months. So again, let's think about it. So the Medicaid expansion group are those individuals, they're low-income individuals that are now eligible for Medicaid because of the Affordable Care Act. They represent close to 30% of the entire universe of Medicaid in the state of New Jersey. So now instead of going through that redetermination process on their cases every 12 months, we have to do it every 6 months. So that's doubling the work in some of our units in Medicaid. That will require more staff. It's going to require more work. What it also does with this population, it mandates engagement of this population in some type of a work activity as well. So at a minimum, every 6 months, compliance with those provisions must be monitored. So similar to changes in that ABOD participation, the work activity requirement for this Medicaid group could impact the local workforce development system. Again, without resources in that system, I'm not sure how they're going to assist engaging this group because it is a lot of people. So what if they're not engaged, right? What happens if they're not engaged and we have to do all this work? Well, they would lose their benefits. Then they come and reapply in our offices, and it could potentially just be a revolving door of us closing cases, opening cases. We already experienced this to some degree. We refer to it as churn, but it's my educated guess that this is going to be an unintended consequence of that work requirement of the provision in this bill. Next slide, please. So that's a little extra work, right? So what could the potential financial impact of some of these provisions be? Again, potential, I'm going to use potential. So to absorb that extra work of conducting redeterminations every 6 months instead of 12 months, to include that extra work of monitoring work activity participation for the expansion group, we're going to have to look at our business processes, and more than likely, we may have to increase staff in our Medicaid units. So in this example, again, we're taking a mid-sized county. So to look at the financial impact, we're going to look at a 2025 CWA budget amount for Medicaid operations, which is approximately $10 million. Again, full disclosure, this is based on some of my budget numbers in Cumberland County. So my total Medicaid budget, $10 million for 2025. My expansion population in Cumberland County is about 25% of my entire Medicaid universe. So now for 25% of my universe, I have to do more work. So it's an increase in staff. It could be an increase in space, facility costs, other operating costs, things like that, for 25% of my universe. So 25% of my $10 million budget is $2.5 million. So if I have to spend extra money, I'm just looking at that as a ballpark figure. Medicaid is, again, one of those line items where there's a federal share and a county share. The federal share for Medicaid is 75%. They pay 75% of our Medicaid costs. The counties pay 25%. So if I'm looking and I have to now budget $2.5 million more for these extra duties, I'm looking at 25% of that county, an additional county share, which would be $625,000 for that year in additional county share to support my operation at the CWA. So all of these, these are the factors that we believe are going to impact our agencies based on the newly signed HR 1. And as I said earlier, it's an educated guess. We're going to be working closely with the state to prepare for some of these upcoming changes. And obviously, we will be communicating with our county administration on all of these things that come down the road. But that's just kind of a quick overview of all of those things. So to wrap it up, I'm just going to turn it back over to Meredith.
Thank you, Cheryl. Nice job. So what's next? As I said in the beginning, this bill was only signed last week. There's still much we have to weed through with the bill. We as county welfare agencies and our association will be working closely with our parent agencies, Division of Family Development, Medicaid, to really implement and review our processes and figure out how we move forward. There are varied timelines as to when different things go into effect. As Cheryl said, the ABODs, the able-bodied folks, those work requirement changes are going to go into effect immediately. The SNAP administrative cost share is effective in 2027, which again, our 2026 budgets for county welfare agencies are going to be impacted. Cheryl gave examples of her county and the size that she is. So in Ocean, I'll give an example. We're a little larger county. That change in the administrative cost to the 25.75%, we would need an additional $4.5 million to cover that cost in Ocean County. And as a state, we're really looking at a total of about $78 million. In January of 27, the 6-month redetermination and the work requirements for the Medicaid expansion population will go into effect. Although we may not fully understand what that really will look like for us and what our requirements will be as a CWA, we know from our current experience working with our Workforce New Jersey recipients who have the work requirement, it's a lot of work. Also just keeping in mind when you look at that 10-year increase in the age of the folks that will be required to attend a work activity, we may be talking about a 60-year-old person who's already worked 30 or 40 years and has retired, and they're on a fixed income. And because they need a little help putting food on their table, they're now going to be required to attend a work activity. But is there really any expectation that they're starting a new career or a new job? Those folks may likely choose to not receive the benefit in place of going to a work activity. Again,
Can you do the next? I'm sorry, I don't mean to interrupt you. The next slide. Can you hit the next
Oh,
slide?
I'm so sorry. I didn't even
Okay.
see that changed.
Yeah.
Yeah. Thank you. So again, our workload is going to increase. Our budgets are also going to increase. And the state is going to have some tough decisions to make. Many of you may have received an email from Sarah Edelman, the Commissioner for Department of Human Services, who estimates that about 350,000 people living in New Jersey may lose their health care coverage. And if that does happen, I think the reality is there will be a significant strain on our emergency rooms. But we also know that the hospitals are going to receive cuts in their funding. So as a result, we may see poor quality of life for many of our folks living in the state of New Jersey. I did want to say also in Ocean County, I gave the example that $4.5 million would be needed in addition for those administrative costs. Cheryl talks about, what really though is the investment. So for, Ocean, I think we generated In health-related services in 2024, $1,162,626. And just that expansion group that we've referred to, the folks that are going to be impacted, who make up in Ocean about 25% of the total caseload, they accounted for $240 million in health-related services in the county. Can we move on to the next slide, please? So what's our takeaway? We already complete a considerable amount of work to make sure that the residents in our county receive the state and federal programs and entitlements that they are eligible for. The benefits do bring in a substantial amount of dollars into our local community. For Ocean, again, the county government does pay a portion of our budget, which is about $20 million. But if we look at the amount that went out in total benefits in the community, which was $1,284,111, that's about 1.56% of that total amount. So the investment is great, but the investment or what we get back into our economy is way greater. The reconciliation bill will increase the work. Our budgets will increase. We may have to add additional staff, but the CWAs will continue to provide the safety net of critical services to our residents. It will be challenging, but it is our mission to deliver the quality services that our folks are used to and that desperately need. And we will continue to do that with all of the support that you give us, which is really greatly appreciated. So thank you for joining us this morning and for listening to our presentation.
Great. Thank you, ladies. That was terrific. It was educational and informative, and enlightening as well. We have time for some questions. I think we have one, and I will tell you that we're going to share this PowerPoint presentation with everyone who participated, who joined us today. So you can have that as a resource. And like I said, if you have any questions, once we're finished up today, please, shoot me an email and I'll make sure, to share it with Cheryl, Lauren, or Meredith, and then we'll get back to you accordingly. So I have one question from Robert. What is driving our error rate and what can be done to improve our error rate?
Well, that's an interesting question. And we've been talking to the Division of Family Development on this error rate because really that is who is working with the feds when they come down to do these reviews. As I said in the presentation, that the state has been battling the feds with what they are counting. They really haven't come back down to us to quantify that in how we need to do our work differently in order to do a better job with that error rate. So, that's maybe something we can take a look at and get back to you, because it isn't something that's pushed down at this point to say, hey, everybody in the counties, we need you to do A, B, and C, and this will improve our error rate. Like I said, the state staff is working with the federal staff to really get down to what the rate actually is and why it's being calculated at that percentage. I know that's not a real great answer, but there is no other answer at this time. We haven't been given that instruction on what we should be doing in order to decrease that rate. You're muted, John.
You're still muted, John.
This Zoom stuff gotta go. Director Robinson, you have a question, and we have a couple in the Q&A that I'll get to.
Yes. Thank you all so much for that presentation. One of my questions has to do with, you talk about the budget, $78 million additional funds for the state budget, but that's based on who is being serviced now. We can anticipate, as you talked about, additional services being needed because just by virtue of how we're living now and what's going on, we can forecast that there will be others that will be needing those services. And then the second comment or question has to do with churn, as you mentioned. And then the error rate, I think, goes hand in hand. As people are having to meet the demands of the enforcement and or whatever the qualifications or requirements are, how do you foresee, how would I phrase this? How do you foresee the enforcement going? Because oftentimes, and I may be dating myself, because oftentimes when you're being provided services, if you do get a job or you have income coming in, because it's income based, then you're completely cut off. Is there a weaning period? Is there an opportunity for people to be weaned off services? I know it's probably adding to the workload, but it's just a thought. So those are my two comments and or questions.
In regards to SNAP, sometimes when folks either change job or work more hours, it may not drop them off the program. They may still be eligible, but there is the piece of additional work because every change has to be reported. We have to recalculate, and then we have to see if the person is still eligible or not. There's not necessarily a weaning period, but there is a process for a fair hearing if there's, if the client feels that maybe they were inappropriately terminated from one of the programs.
Great, thank you. So we have a couple of questions about why is it assumed that the counties are responsible for picking up the difference on the administrative cost shift, and I'll give you my layperson's answer, but we'll then defer to our subject matter experts, and that's because that's been the law, statutory law, for at least 50 years and probably longer, that the county governments are responsible for administering these types of programs. And again, there's only 10 states in the entire country where SNAP and Medicaid are administered. So ultimately that burden will fall, on county governments. We can of course advocate the state to change that statutory law, to put money in the budget to help. Or certainly that has to be part of our strategy moving forward. But if nothing goes unchanged between now and then, it is the county's responsibility because of the way that the law is structured. So I don't know, Cheryl or anyone else who want to add to that, but that's my take on it.
Yeah, no, John, you're right. And again, it's because we're county administered, right? So
Okay.
They are our administrative costs for our offices, for our staff, for our operations. So that's why the county is pushed to the county, the cost share for the administrative costs. Goes all the way, like I said, goes all the way back historically to how we were set up, said in the 1930s.
All right. Listen, this was terrific. I can't thank you enough. I know we're going to work very closely together over the next, couple of months on understanding what these changes mean for New Jersey. I appreciate it. Wait, we did have one more question, and it was about error rates. And I think we did talk about that, Cheryl. I think you mentioned that a little bit. So we'll again, if you have any follow-up questions after we're done, just shoot me an email, and then we'll get back to you with an answer. And again, we'll make this PowerPoint presentation available to anyone who participated today. And just again, want to thank everyone for being here, and thank our panelists for doing a terrific job and all the good work that they do. So thank you, and have a great rest of the day.
Thanks, John.
Thank you.
Thank you.